Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And joining me once again to talk about the coronavirus is Dr. Rashid Chani. He is medical officer at IEM and infectious disease expert. Doctor, thank you so much for joining us once again.
Thank you for having me to talk about this very important subject that is not just affecting the United States, but the entire world in a very, very bad way.
It certainly is, Doctor. We are seeing cases increase just about everywhere. I want to ask you, does it really come down to people masking, social distancing, and washing their hands? Is it really that simple?
Well, it is not that simple, but as we had already predicted that during the fall and the winter time, we are going to have more cases, and that's what the rest of the world is seeing, and that's what we are seeing in the United States. What are the measures that we've got available to us right now are three things. Those are the three things that you just mentioned: masking, social distancing, and hand hygiene. Right now, we do not have a vaccine. Yes, the vaccine is coming, but we don't have it as yet. So we've got to use those particular measures. We have a monoclonal antibody that has been approved by FDA, and I believe that in the next few months, what's going to happen is that people will be going and getting tested, and if they're positive, then they will be getting an infusion of their monoclonal antibody, which takes about 1 hour to infuse, and then you've got to wash them for 1 hour, and then they can go home. So we do have a treatment, but it is not widely available at this point. Till we have that treatment widely available, till we have the vaccines that are out, and FDA approved and given an emergency authorization use, and we've got some really good vaccines. We have to use the measures that we've got, and we've got to do the masking, social distancing, and hand hygiene.
I want to talk with you about just what we're seeing in regards to the number of cases and the number of deaths. I mean, it just keeps climbing in both categories.
Absolutely. Right now, we've got 11.6 million cases, and we've passed a grim milestone. And I feel terrible talking about it, but we have 251,000 deaths in the United States. The deaths are not as high as we had seen. Daily deaths are not as high as what we had seen in the spring. But unfortunately, I have to say that these numbers will rise. And deaths always follow 2 weeks after we've had surges of cases. Now, we've gotten much better in taking care of patients in the hospitals, and our mortality rate has decreased. There's no question about it. But when you have 160,000 cases per day, right, which is a 77% increase looking at the last 2 weeks, I mean, you're going to have deaths associated with them, even if they're less percent-wise compared to what we had in spring. We're still going to have a tremendous amount of deaths. And, it's unfortunate, but the rate that we are moving at, by Christmas, we could have 2,500 deaths a day in our country. And that is what is just unbelievable at this point. And it's extremely heartbreaking to see that. Even if people are going to start getting the monoclonal antibody outside the hospital in an outside setting, it is going to take time for all that process to take place. Once the vaccine is out, and I can assure you that by the end of this month, I believe both of the vaccines, the Moderna vaccine as well as the Pfizer vaccine, are going to get FDA EUA approval, because right now the immunogenicity data and the safety data on both of them look really, really astonishing. And they've just exceeded our expectations in terms of efficacy or effectiveness, as people call it. And we were expecting something which was going to be 50%. Now we are seeing something that is unbelievable, almost 95% effectiveness of both of those vaccines. But, to roll that out, to have people get the vaccine, by the way, you have to get 2 doses to actually develop that 95% effectiveness. So it's going to take some time. And we just, which is unfortunate. It's remarkable that we have all of these things that are coming out during a pandemic, during a major surge. But right now, the virus is in control. We are absolutely not in control. So we've got to just make sure that we keep ourselves safe as possible.
You mentioned vaccines, and obviously, so much incredibly positive news coming out from these two vaccines, at least these two right now. How realistic is it, doctor, that a large number of Americans are going to be receiving this vaccine shortly after the new year?
It's not going to be happening to a large number of Americans who will receive the vaccine. When the vaccine comes out, the CDC, FDA approves it. And then with CDC and ACIP, as well as the National Academy of Medicine, it is determined who are going to be in the priority list. So the healthcare providers in harm's way who are taking care of COVID-19 patients, elderly with comorbidities, elderly after that, and then mission essential people, physicians, nurses, police officers, firefighters, all the essential people, essential workers are going to get that vaccine. And after that, you will have school teachers probably and students, and then it then goes out to the general population. So it will take some time. We will not get the vaccine to the general population before the end of the first quarter of next year, if everything goes smoothly, or the second quarter. So there is still a lot of time left, for people to get the vaccine.
And when you mention, obviously there is a lot of time before we see mass distribution of the vaccine. What are you encouraging people to do in the meantime? Obviously, doctor, we have Thanksgiving coming up next weekend, followed by Christmas. What are you encouraging people to do when it comes to traveling and seeing family?
Well, I would say do not travel. If you want to see your family, do a Zoom meeting. Try to keep yourself safe as much as you can. If it's just, if you have to travel and you're not going to stay away from travel, make sure that you're using a proper mask. Make sure that you're keeping social distancing. When your kids come from college, right, there are so many colleges, so many college towns where the outbreak just exploded. Fortunately, those kids are not going to get serious illness, but they can give it to you, and you will then suffer. So when the kids come home, just make sure either they've isolated themselves for 2 weeks before they come, or what they can do is they can isolate themselves, and you can wear a mask in the house, and and keep the social distancing if that's what's going to take. But you got to be careful. The virus acts in a very bizarre way. I've had families. The wife has it, a husband didn't get it, kids got it. What is going on? The husband had the most exposure. He does not have any type of antibodies. The virus acts in a very, very, very bizarre way. So we got to be very careful, very cautious. Just let's pass this time. Let's take care of Thanksgiving and Christmas and New Year's, and just be in our own pod. Next year we can definitely enjoy. We're not out of the woods yet, but we might be approaching the beginning of the end at this point. This perhaps is the first time, as I've mentioned, that the vaccine has been approved during a pandemic. We've got a therapeutic that has been approved that is going to be out there, which is just a tremendous scientific feat. I've got to give credit to Operation Warp Speed for doing that. But believe me, better days are definitely coming. But for now, let's all keep doing our part, mask up, stay home, and count the days until we can line up to get our shot, the vaccine.
Yes, and doctor, my final question for you today, you mentioned colleges. A lot of students will be going back home, and in a lot of states where kids right now are at school and doing in-person learning, they're going to be taking these breaks soon. Do you anticipate that they will then return to the classroom, or do you think that this will now be the time that more schools, more colleges will move solely to that distance learning model?
Well, more than 2,500 cases have been reported among students and employees at 1,600 or 1,600 institutions across the nation. So yes, there have been problems. There have been 80 deaths among teachers, but we have already seen that football players in California and Pennsylvania and a sophomore in another place have essentially died due to contracting the disease. 10 states, college towns, Texas, Florida, Ohio, Pennsylvania, Wisconsin, Georgia, Illinois, Indiana, North Carolina, and Michigan have the highest number of cases among students in the campus setting. So yes, what's going to happen, I believe, is that once these kids come back home, the rest of the classes, as we see the numbers of cases rising, probably most of the classes for the rest of the year are going to be from their homes, or else if they are in an apartment in a college town, they'll be taking classes from their own apartment. There probably are not going to be any in class teaching for this year, or probably the next semester also. It's just not going to happen, because we are just going to have more cases and disease will spread. So in order to control that, we have to have no in-person classes and remote learning, which is tough for the students, but that's how, unfortunately, things will look for the next few months.
I know that whenever we wrap up this conversation, you always like to give your final thoughts. And I'm just thinking about all of those students, Doctor, who have really endured so much, missing out on so many things. Your advice to them, if in fact now they're going to be removed from the classroom and finish out the school year at home.
Well, one of the things that I have appreciated looking at my kids also, who are, taking all the college classes from home, and there are high school kids that I got, and I've got elementary school kids. So, I've seen all of it. One of the things that I've noticed is that the kids are extremely adaptive to what they get, the surroundings, and they keep themselves busy. They have learned how to cope with this problem. Social media has helped them quite a bit, and all the technology that's out there is helping them communicate with people and talk to people and be together with their friends, remotely. I believe that adults are having a much more difficult time than the students, because how technologically savvy they are. Yes, it's not easy not to be in a classroom, not to be enjoying time with your friends after you've had your classes, because that's what you want to do when you're in college. But at this particular point, they can't do it. But I honestly believe that they will be able to endure this thing. They will be able to successfully complete their semesters. And if nothing else, one of the things that they have to think about are their family members, their parents, making sure that they're not bringing the disease back home, so that their parents are not getting sick or their siblings are not getting sick. Because we all have to work together. Sacrifices will have to be made. Sacrifices are being made in a big way by all these students. And I am so delighted to see that, more than adults, the students are actually following directions which was not anticipated, but they are. Majority of them are being very careful and cautious, and they know what's going on. They follow the news, they look at the data, and they appreciate how the difficult times that we are in, and how difficult it is to deal with this virus. So I thank them, and I hope they continue to do what they're doing, because that's what we need. The nation needs them to be, doing and giving this sacrifice, and not giving up studying, and not giving up their academic goals that they have,
Mm-hmm.
and just keep pursuing them.
All right. Thank you so much, Dr. Rashid Kutani, medical officer at IEM. Always a pleasure. Thank you.
Thank you so much, and appreciate it.